With the government shutdown now nearing the 1-month mark, tensions flaring on Capitol Hill.
SNAP recipients shouldn't go without food. People should be getting paid in this country. And we've tried to do that 13 times. You voted no 13 times.
Good afternoon, everyone. Hello, I am Dr. Haydée Brown.
I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. And so you just saw it. The tensions were flaring on Capitol Hill this week. That was on ABC. And their reporter said that the lawmakers clashed, whether it was about to restore the food assistance or the funding for millions of Americans. And so Republicans and Democrat lawmakers are once again at a stalemate, you guys, unable to agree on the funding solution that's going to reopen America. This is the second longest shutdown in American history. And this week marked the GOP-led senators' 13th failed attempt to pass a bill that would keep the government running until November 21st. So meanwhile, the House remains out of session, like on vacation, I guess, paid vacation, no less, when millions of Americans are not going to be fed. I digress. So as Americans are feeling it, we're frustrated. The blame game, the gridlock, both parties pointing fingers as the clock runs out. And families, not just individuals, families rely on what SNAP, the Supplemental Nutrition Assistance Program, benefits. And so the Department of Agriculture has announced that the SNAP benefits are running out and they're not going to respond until Congress acts. So Trump said his administration insisted the department lacks the legal authority to use its $5 billion contingency fund to continue the benefits. So there's actually money sitting somewhere that they can't use. But Democrats disagree. They said there's about 24 states who have now filed lawsuits to keep the funds on the table for millions of families that will be affected. So here's the reality. We look at it medically. When prevention suffers, systems break down, quietly is kept, then all at once. It's like a bum rush, And so as physicians, Dr. Brown and I, we've seen this time and time before. The access to nutrition or insurance, when it's cut, the dominoes slowly start falling. And that's what we call a health crisis. So let's be clear. It's not just politics. We've been saying it. It's about people. And now almost 40 million Americans, children, veterans, people that have served this country well, and senior citizens rely on SNAP to eat day to day. And when those benefits stop, it's not just about hunger we're talking about, it's about their health. And so let's start with nutrition and how this affects everything. We say it all the time, food is medicine. That's not a slogan, that's physiology. So when families lose access to consistent, healthy meals, primarily through programs like SNAP, they don't just lose their meals, those empty plates. That is, they're stressed out, so their blood pressure rises. They're eating unhealthy, so their glucose goes up and their diabetes is uncontrolled, which means poor wound healing and bone mineral density loss because they're not eating healthy. And children lose growth and learning, and literally they're stunted. Food is it's medicine. It is medicine. And so the body can't heal without it. You need fuel to repair itself. So while Congress is debating budgets and partisan wins, we're left talking about the basic lifelines, food and healthcare cut for millions of Americans. So Dr. Brown, I'm not exactly sure how this is all making America great or healthy again. Let's roll this clip.
This isn't a political game. These are real people's lives that we're talking about.
Senate Majority Leader John Thune blocking a Democratic bill to carve out funding for SNAP, saying Democrats should instead vote to reopen the government. Democrats claim the Trump administration has other ways of paying for SNAP and say they won't agree to reopen the government until Republicans extend health care subsidies to prevent premiums from skyrocketing.
We don't want to pit health care and food. They do. We think you can have both.
Americans on Obamacare now getting their first look at just how much more they could pay next year. One research group saying premiums will rise an average of 26%, but those currently on subsidies could see premiums double.
Dr. Brown, this is crazy.
It is crazy, Dr. Sloan. It's definitely crazy. Senate Majority Leader John Thune, in one of his most animated performances to date literally shouted down an attempt by the Democratic Party, Democratic Senator Ben Ray Lujan of New Mexico, to keep food assistance flowing for millions of Americans through the SNAP program, which is better known as food stamps. Lujan's bill was simple, very simple. It would allow the USDA to tap into these contingency funds to continue the SNAP benefits. And that's while the government would remain closed. But Thune, he blocked it, yelling that if Democrats wanted to fund SNAP, they should just reopen the government. His words, not mine. We've tried 13 times and you voted no 13 times. Now let's just pause the politics and talk about what's really at stake. SNAP, the Supplemental Nutrition Assistance Program, currently supports over 42 million Americans, including 1 in 4 Black households and nearly half of all U.S. children at some point during the year. If these benefits lapse, it's not a political inconvenience. It is a food crisis. Look at the lines at the food banks already. And so according to the Center on Budget and Policy Priorities, more than $7 billion in monthly benefits are distributed through SNAP. And that's gone as of November 1st. So that means if the shutdown continues, millions will lose access to those funds overnight, including roughly 3.6 million Texans, 4.3 million Californians, 1.7 million Floridians. And here's the reality. The USDA's reserve funds can only stretch about 30 days past a shutdown, which means that by early November, families could start seeing these $0 balances on their EBT cards. So imagine being a working mother who depends on those benefits to feed your kids. And then suddenly you're told the government's closed, come back later. Is that accepted at the supermarket as a payment? I don't think so. And, Thanksgiving is on the horizon, and we're looking ahead to the holiday season. So, this isn't just a policy debate. It's about priorities. While Congress is arguing over political blame, Americans are deciding between rent and groceries. And so when we hear shouting on the Senate floor, particularly from the GOP, remember that noise isn't just political theater. It's the sound of millions of empty plates waiting on leadership to do their job. So how big is this? Let's roll the clip.
So, Alexis, how big is the impact here if SNAP benefits run out?
It could be devastating. In fact, I saw this one quote from the CEO of Hunger Free America. He says, we would have the greatest hunger catastrophe in this country since the Great Depression.
Wow.
The loss.
I don't think I've even put it in perspective of what that means, because we're a different generation. We don't even know what that means,
We don't. And I think we're just starting to see a peak of it with, people going to food banks, which is more a reflection of all the layoffs, right? But this loss of SNAP benefits is not just going to be this policy failure. It's a historic collapse of our social safety net. We're all paying taxes. We all pay into this system so that we can benefit from it. But no, for the first time in decades, millions of families, children, veterans, and seniors face empty tables, not because food is scarce, but because leadership, specifically the leadership of this country, which is led by the GOP, has failed. Now, this moment will be remembered as one of the most consequential humanitarian setbacks in U.S. history, because let's just take a look at this slide about how many actual people will lose their SNAP benefits. So by the numbers, nearly 42 million people, 42 million receive SNAP benefits. That's more than 62% in households with children, and 37% include adults, older adults, or people with disabilities. So really, again, it's the weakest in our society. And so the cruelty is the point, Sadly, these are human beings. These are families that are stripped first of their ability to eat, then of their access to healthcare. Right? That's the government shutdown is about healthcare. So what follows is predictable. You get mass distress and unrest. You get desperation. And then comes the so-called need for all these National Guards, policemen that are in these major cities, which is a state-sponsored response that was unimaginable just a year ago. And here we are. It's entirely predictable now. once cruelty became federal policy. So Dr. Sloan, this is all happening over Thanksgiving and the holidays and the new year. What are you thinking?
This is, it is cruel. It's very cruel. And now layer on top of that, this hunger crisis that's about to occur on top of the insurance access or lack thereof. And so remember, we talked last week, according to this Kaiser Family Foundation document that was released, that showed that Obamacare insurance premiums are going to jump or have already started to jump by the end of this year to about 26%. And that is definitely the sharpest increase since it was even launched, you guys. And so now this whole federal marketplace where you could try to get affordable health care is going to go up to by 30%. So the kicker is enhanced subsidies have kept the premiums affordable for millions of families. They're going to be expiring on 12/31 of this year. And that means the $200 monthly plan now is suddenly $500 or $600, like literally overnight. Not that anything really changed the market, but just the government. And for 24 million Americans who currently are insured by the Affordable Care Act, that's not just a price hike. That's an emergency room waiting to happen. That is when people lose their coverage. We call that prevention becomes the first casualty. So that means no more routine checkups. They're not just going to go for preventative care anymore because that's going to be expensive. Mammograms, colonoscopies, lab tests, all those are going to get postponed. And so prescriptions are going to go unfilled. And again, these are all preventable things, right? So urgent now becomes emergent, if you will. And the cost is more than just financial. It's physical, it's emotional. Everything is going to skyrocket. And the truth is, we don't even have a spending problem in America. That's not the problem, you guys. It's the misallocation of everything. We fund emergency rooms instead of doing early screenings, things that can be prevented and treatable before they ever happen. So, Dr. Brown, we budget for crisis, not care.
Dr. Sloan, every time we cut nutrition programs or reduce access to health insurance, we're defunding prevention. Mm-hmm. And prevention, right? That's the backbone of public health. And so for the policymakers listening, prevention isn't charity. It's the ultimate strategy. Because you know what? Hungry people can't work. Sick people can't work. They can't thrive. They can't feed their families. They can't fuel an economy that's built on the very labor that their hunger disables. And for the communities feeling this right now, the moms, the caregivers, the working class families juggling bills and meals, prevention is your power because the healthier you are, the more resilient your community becomes. But that's hard to do if you cannot pay for food. So when we talk about shutdowns, budget cuts, and subsidy expirations, remember this. Remember this. They're not abstract numbers at all. They're their blood pressure readings, they're your hemoglobin A1C, right? So your blood sugar readings and life-saving screenings waiting to happen. And then the longer we delay that prevention, the higher the human cost. So say you actually go to the ER for an emergency, you might not be seen immediately because everyone is there getting what could have been preventative care now is this urgent care. So in 1 month, we've gone from cutting off food benefits to pricing people out of healthcare. And those are the two most basic things that any government should guarantee its people: food and medical care. When a working mother can't afford her groceries, and when a diabetic can't afford insulin, and then Congress calls this all fiscal responsibility. Dr. Sloan, I have one question to ask out loud. Are we great yet?
Hell no. I mean, we are going down in flames right now in America, and everyone is crying out with no help, and unless it's your voice. And so we want you to keep watching the MeidasTouch Network. Stay informed, stay vigilant, and remember, truth is your power, and that's where you can get most of your tools from. Organizations like MeidasTouch Network. So we're AYA, contributors to MeidasTouch Network, and proud members of the Meidas Mighty. We want you to subscribe, like, share, comment, follow for more updates because we're not going down without a fight. Have a great week.
Thank you, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.